Today, we're going to talk about something that is so deeply personal, but at the same time, it's an experience shared by millions of women. We're going to explore birth trauma and postpartum depression through the really powerful journey of an author named Sarah Hoover. We'll see how she took a totally devastating experience and turned it into a masterclass in advocating for yourself. So let's start at the moment her whole world turned upside down. And this quote, wow, this is really the heart of a whole story, isn't it? It's that exact moment when one of the most anticipated, joyful events of your life suddenly becomes this source of deep, deep trauma. It just perfectly captures that feeling of disconnection that sent Sarah into a year-long depression and a fight to get her own story back. So that really brings us to the big question we're looking at today. How does this happen? How do you go from the beautiful picture society paints of motherhood to the messy, painful, and honestly, really complicated reality that so many women face completely in silence? Okay, so to really get a handle on the impact of Sarah's trauma, we first have to look at the life she had built. I mean, by all accounts, this was the dream she had been working towards her whole life. You know, from the outside looking in, Sarah's life was pretty much perfect. She had this dream job at a big art gallery, she had a loving husband, and she was following what she calls the path we're all taught is the right one. You know the one. Get married, get pregnant, have a baby. She was absolutely ready for that next chapter. But here's the thing. That dream, it was a world away from her reality. While we're all told pregnancy is supposed to be this blissful journey, Sarah was slammed with horrible nausea that just wouldn't quit for 20 weeks. She felt incredibly lonely because most of her friends weren't parents yet, and instead of that natural fulfillment, she was terrified, absolutely terrified, of losing the identity she'd worked so hard to build. Looking back, she thinks she was probably already depressed during the pregnancy itself. So this really tough pregnancy, it was just the beginning. It led right into an experience that would, as she puts it, just completely break her. Let's walk through the events of the birth itself. So on her due date, Sarah's told she has a tear in her amniotic sac and boom, she needs to be induced immediately. She remembers just sitting outside the hospital, sobbing with this awful feeling that she was actually going to die in there. And what came next was a 19-hour labor that, while it wasn't a medical emergency, it was deeply, deeply traumatizing for her. Okay, but this right here, this single comment, it's chilling. So during a procedure to break her water, which was incredibly painful for her, this was her doctor's response. It was a moment of total dismissal. Her pain wasn't just ignored, it was completely invalidated. And that comment, you can just feel the switch flip inside her head. It forced her to mentally check out. She basically divorced herself from any emotion, any hope that this would be a special experience. It wasn't about welcoming a child anymore. It was just about survival. Well, that feeling of being at war, it didn't just disappear when her son was born. Nope. It followed her home and it kind of morphed into something totally different. This silent, really isolating illness. You know, when we think of postpartum depression, we usually picture someone crying all the time, right? But Sarah's symptoms were different. She was irritable, she was angry, and she felt, in her words, dead inside. She would look at her newborn son and feel absolutely nothing. And that is such a crucial point. PPD shows up in so many different ways, and this complete lack of connection is one of its most painful symptoms. And the thing is, she was so far from alone in feeling this way. It's estimated that 1 in 7 women will experience postpartum depression. That is a huge number. It's an incredibly common complication of childbirth, but the shame and the stigma around it keeps so many women from ever speaking up or getting help. And when you look at it from a medical perspective, I mean, according to Dr. Thais Eliabadi, Sarah was basically a perfect storm for postpartum depression. All the red flags were there. Nausea that lasts past 14 weeks, that's a huge indicator for anxiety. A history of trauma, a difficult birth, these are all major risk factors. Her experience wasn't a personal failure at all. It was a predictable medical outcome. So for a full year, Sarah was just spiraling. She truly believed she was a monster, a failure as a mother. She was even on the brink of ending her own life. And then one single conversation changed absolutely everything. It was just a routine checkup, but her GP asked her a couple of simple questions about her marriage and how she was feeling about her son. And based on her answers, the doctor looked Sarah dead in the eyes and said this. It was so blunt, so direct, and it was exactly what Sarah needed to hear. It was the very first time someone actually saw the crisis she was in. And that was it. That was the moment that kickstarted everything. Sarah found a therapist she really connected with. And even though she had her own deep-seated stigma about it, she started taking an antidepressant. She said it felt like a massive weight had just been lifted. The medication didn't change who she was. It just let her be herself again. So as she started to heal, Sarah realized something huge. She wanted to have another child. But this time, the birth was going to be on her terms. And this is so important because she didn't just hope for the best. No, she took all that trauma and turned it into a concrete plan of action. She worked through her past trauma with intensive therapy. She literally armed herself with scripts, exact sentences to make sure her voice would be heard. And she didn't just settle for any doctor. She interviewed them, building a team that was 100% committed to her well-being from the very start. So what was the result of all that work? I mean, this slide really says it all, doesn't it? The second birth was everything the first one wasn't. It was beautiful, it was spiritual, and she felt completely safe. Instead of trauma, she felt giddy. Instead of disconnection, she felt this instant, overwhelming love. She actually calls it the best day of my life. And you know, this might be the most powerful part of her whole story. The things she fought for, being told what was happening before she was touched, having her pain taken seriously, feeling empathy from her care team, these weren't some radical medical demands. They were, as she says, just basic human rights. Look, Sarah's story is just incredible, but it leaves us with this one big question. She had the resources, the education, and the sheer force of will to fight for a better experience. But what about all the women who don't? What would our maternal health care system actually look like if compassionate, patient-centered care wasn't something you had to fight for, but was just something every single mother was guaranteed?